We've got Inge Cordner, who is the lead nurse for the nursing and midwifery workforce, and Claire Stranack, HR business partner. And they're going to talk to us a bit about a pilot program that they've been running within their trust. So I'll hand to you, Inge and Claire.
Hi, everybody. Thanks for that introduction, Amy. So I'm Inge. I'm the lead nurse for the nursing and midwifery workforce. And I've got my colleague who I work very closely with here, Claire.
Hi, everyone. I'm Claire Stranack. I'm a HR business partner and I work in corporate at UCLH.
Okay, so next slide. So what we're going to talk about today is that currently we're working with TimeWise, and we are doing a self-rostering project for a few of the wards. It's a pilot with the intention, and we'll speak about that at the end of the presentation, about where we actually want to go with self-rostering. So just to give you a bit of a background about why we looked at self-rostering as a project to help with flexible working. So we have the external drivers, which we've put there, the NHS People Plan and the People's Promise. So the NHS People Plan, or the NHS and the long-term plan as well, it spoke about recognizing that the NHS as a whole, we weren't sufficiently flexible and responsive an employer. So we needed to change because the expectations of staff for their work-life balance, which was changing for their lives and for their careers. And then with regards to the NHS People Promise, one of the promises that we work flexibly. It's saying that we don't have to sacrifice our family and our friends for our interests or for work. And it's talking about flexible working patterns. And if we don't allow staff to take the time off that they need, then we aren't supporting them and they aren't supported to care for events outside of the work environment. And then to a lesser degree, we are a team as part of the People's Promise. And this part of the People's Promise really is about supporting each other and taking time to celebrate each other and our successes. Now, of course, we've got the 2019 government commitment to increase the nursing workforce by 50,000. We aren't quite on track with that nationally, but it's recognized that supporting staff to work flexibly, just a minute, supporting staff to work flexibly will help us with our retention and also our recruitment figures. So some of our internal drivers was around flexible working as a recruitment and retention tool. And we thought that we did a bit of with the history of self-rostering, but we weren't able to put this into place. So just before COVID, we actually trialed self-rostering. And the feedback we got was really positive. The managers were involved, the staff as well, to a large extent, were really positive about it, but we didn't have the infrastructure or the system to support this, which is why the next slide will show. Can I have your next slide, please? So we now implemented the health roster system, which gave us the opportunity to use technology to support us with self-rostering. So we talk about rostering, but in terms of self-rostering, we recognize that rostering didn't seem as if it was possible for everyone, self-rostering that is. That's because we had feedback from some staff members that they felt as if self-rostering was only if you had childcare responsibilities, which obviously is not quite true, as we can see from the external drivers and the NHS People Plan, etc. Also, it was one of our strategic aims in nursing and midwifery to support our staff to work flexibly in order for them to feel valued at work. What we do recognize, though, is that in the NHS, especially on ward areas, is that we have a unique scenario in that inpatient areas, we require 24-hour coverage to ensure our patients are safely cared for. So thinking about we want our staff to work flexibly, we've got to provide 24-hour care. What could we do to try to facilitate this, which is why we've started the self-rostering. Could we go on to the next slide? So I've mentioned about the 24-hour areas unable to access the wide variety of flexible working options out there. But what we also got from our matrons and our sisters was that they as well thought that self-rostering would be a solution. And the feedback we had from the previous trial told us that we also have evidence from the literature that self-rostering can actually unlock the flexibility for these self groups. So when we think about rostering, though, you have your team rostering and self-rostering. So the question would be, why did we go towards self-rostering as opposed to team rostering? And I guess mainly it's because with self-rostering, a lot of the dynamics in the relationship between the management of the roster and the staff, it's pretty much equal. So you don't have that sort of autocratic approach to rostering when you use self-rostering, even though team rostering does have its place, because if you've got a really large unit, then obviously I think team rostering might work better there. Could I have the next slide? So if we think about our approach, so at UCLH, we have boards. We've got 3 boards, but one of them is split into 2 really. So we've got about 4 boards, and we wanted to make sure that each board was represented, so that we had a wider, I suppose, voices talking about if self-rostering would work for them. We also thought about the size of the wards, because we looked at research that showed that if you have wards over under 35, self-rostering worked best for them. If you had wards 35 to about 70, then team rostering worked better. And anything over 85 or so, then you had that normal autocratic sort of departmental rostering. So we looked at the size of the wards as well. And also in selecting the wards, we wanted those who were really engaged. And in fact, some of them contacted us, or contacted me to say that we are interested in self-rostering. We heard you tried it elsewhere. We would like to take part in this. One of the wards was part of the previous pilot. And it also helped that because we were rolling out a new rostering system, that the staff were pretty much learning the system and very engaged, and they wanted to use the system to its maximum degree, really. And so it was a really key time for us to go in there with the self-rostering. So the wards that we chose in the end were, I know the names mightn't mean much to you, but what we wanted to highlight was the whole time equivalent attached to those wards. So we've got a couple of wards, which is TO9, South and Central, Central and North. They're pretty much the 32, which is typical for self-rostering. We had another ward at 41.5, which was slightly over. And then we had our TO8, which is 68.25 whole-time equivalent. So just about, not quite double what the sort of like the maximum the literature showed was conducive to self-rostering. Now, the literature didn't say that it wouldn't work. It just simply said we needed to put more support in for it to work, which would be things like communication and engagement and the whole culture, and really encouraging teamwork. So if we go down to time-wise involvement, and I'll hand over to Claire, who could talk about that.
Thanks, Inge. I just wanted to give a brief mention to kind of why we chose to involve TimeWise and how that's kind of worked out. And really for us, it was about having that dedicated resource to support the rollout. So the last 12 months have been really hectic for everybody with industrial action and things like that. And so part of the reason that we kind of put the case forward to spend some money on some TimeWise investment was that kind of capacity issue. And we also knew that they had the kind of experience of rolling out this in other NHS organisations. And although Inge and I had some experience of that ourselves personally, we felt to kind of achieve a trust-wide rollout that would be helpful. If you go to the next slide, I'll just talk to us about approach. So I'm not going to go through this in too much detail because there's a lot there, but I thought it'd be useful to kind of share for the slide pack. So this is really the approach that we took on a single slide. So it started back in kind of May, June earlier this year, where at which point we were kind of very much having research conversations with ward staff, so trying to understand the current position, thinking about our policies and how they would fit with self-rostering. Do they enable that? Do they help us kind of promote self-rostering? In designing our pilot, we, as we said, identified different ward areas to ensure that we had representation across the organisation, but really involved those ward sisters and matrons right from the start to kind of really design this pilot and make sure that it would work in their areas. We spent a lot of time on engagement with the ward teams, and I think that's been really beneficial. And then we launched the pilot from kind of July onwards. So at the moment, the pilot is really still ongoing. We're kind of at the evaluation stage. So they're just working their first roster that is a proper self-rostering roster. And we're kind of evaluating that to see how it goes at the moment. But we've done some kind of initial feedback, and our initial thoughts are really positive. If we can go on to the next slide. So again, I'm not going to go through too much of this, but I just want to share our data. So we're really, really proud of our uptake data, and trying to get into the data on this has been something that we've been really passionate about, to make sure that we have a really good understanding of kind of what's happening in practice. And the really great thing about using e-rostering is that you can do this and you can analyse it. We've also done lots of conversations with the wards to kind of understand their perspective as well. But this is it broken down by band, so you can see across the different areas there's a bit of variation. So typically we're seeing more of the band 5s and 6s engaging in this than others, but in some areas, so for example T9 Central, they've done a really good job of kind of engaging more broadly across the board. What we tried to look at with this data is we took our staff in post from ESR, but then what we recognise is that we have a lot of people already who might be on fixed patterns, so probably weren't going to move away to self-fostering because they had very fixed requirements. And we've tried to kind of exclude those people to give a better percentage. You will note, for example, that T8, they've got some zeros in there, and that's because they're not using the roster to auto roster. So this data is just based on what is in the system. We know for T8 there would be some more, but I suspect for the other wards as well, there'll probably be a handful of extra people here and there that wouldn't self-roster because they've got fixed patterns that might just not have been popped in. But what that shows overall for the average for the 3 months so far is that we've got an uptake rate of on average 61%. And obviously we've got some variation between the wards, but overall we've been really pleased with that as a number, and it's been really great to see that engagement. And I think what is really interesting is if you look at T9 Central, you can see them as a kind of success. And I think Inge and I would probably both say that the engagement on that ward from the ward sister has been really, really fantastic. And she has really, really helped us drive that, which has been great. If you go into the next slide, so we don't have data for January yet because that roster's not been finalised, but this is looking at how many shifts have been requested using self-rostering and what percentage has been approved. So again, November we had a 76% approval rate across the 3 areas, and then moving into December, interestingly, it's actually gone up for the Christmas rota to 80%. And we had an increase across all areas with the exception of Bernard Sunley. We don't have the data yet for January. So at the moment, we're very much at our kind of evaluation stage. So we're waiting for our January data, and then we're kind of engaging with staff at the moment and the ward sisters and the matrons to talk about the experience and how it's felt for them. And we've done a lot of that engagement already. And overall, I think the initial feedback has been really, really positive. If you just go on to the next slide. So these are some of our challenges. So this is from the literature in terms of what we thought we were meant to be expecting in terms of challenges for self-rostering. And the ones in bold are the ones that we feel like we've maybe seen in reality. So I think there are some things that haven't been as much of an issue as we thought they would be. We've had some difficulty with things like the nurse in charge responsibility. We found that some of our band 6s were booking shifts, but not necessarily adding on that nurse in charge responsibility, which meant that the ward sister would then have to reject their shift and rebook them. So part of that, I think, is about training and understanding, and just making sure that people are really clear that they have to take on that responsibility. We had some worries about first come, first served, but I will say less than I expected. So we had some feedback in particular about, so the technology, the way that it works for us is that the shifts are available to book and they get released at midnight. And we had some staff raise that as an issue. Unfortunately, we can't change the time. And so it's kind of something that we're stuck with. And so it's been raised as an issue, but I would say to a lesser extent than I expected, and certainly not enough that people didn't want to carry on with self-rostering. Inge, I don't know if there's any other challenges you want to highlight there from a nursing perspective.
No, I think you've mentioned the key ones that we've highlighted there.
Fab, thank you. Thanks. If we go on to successes then, so looking at it the other way, so like I said, we've been engaging with the wards, and what's really interesting is we've done a lot of that, interestingly, through Microsoft Teams. So we did do some ward visits, and actually we found that it's been easier to engage with our teams via existing ward meetings and things like that, and that's where we've been able to kind of reach the most people. When we went to the wards, I think typically everybody's just really busy and it can be hard to kind of grab people for a chat. So but those engagement sessions have told us so far that we have had feedback that people feel that they've got more control over their working lives. So we've had some comments particularly around people who have to organise their lives around their partner shift patterns, that self-rostering can be really helpful, particularly if their partner shift pattern is unpredictable, then it kind of allows them to get in and book. We think we are getting there with the encouragement of stronger team spirit. So I think initially maybe people go in and a little bit more selfish and book for themselves. But I think as we've gone through the pilot, we've really seen that improve and people thinking about that kind of wider team level. Something that really surprised me was the amount of time that the ward managers saved. And that was something that they've kind of fed back initially without us even asking. And I think we had one ward manager, and Inge, you can correct me if I'm wrong, but he said that typically they would spend around 6 hours doing the roster, and they think with self-rostering, they'd got it down to 2, which is a really great improvement in terms of the kind of time. Again, we've highlighted in bold the things that we've particularly seen, but this is from the literature in terms of the types of stuff that you should expect to see. And I think we've seen some of that come through, but probably not all of that come through just yet in our pilot. Inge, is there anything you wanted to add to the successes? Sorry.
Yeah, I think so. Those were the successes we've seen so far. But of course, we're thinking about other successes that we potentially would see in the future. And that will be things like, especially from an organization point of view, that we would see less swapping of shifts after the rosters have been put together. We're hoping to see less reliance on the agency and bank into the future. And then we're also hoping to see a reduction in baseline sickness. So those are things that we're looking forward to seeing realized, I suppose, possibly maybe in about 6 months or so after the introduction of self-rostering.
So just in terms of where next and where we're going with this, so as I've already mentioned, we're kind of evaluating our pilot at the moment, so it's very much a live project still. We're very much considering a trust-wide rollout, and we think that that's something that we probably will go ahead with. We've got some concerns about some particular areas, so our IT and ED teams have just been through consultations and they have quite fixed rolling shift patterns. So we're not sure that we want to kind of disturb those areas just yet, but we are thinking that it could be applicable across the rest of the trust. We've interestingly had some interest from other staff groups. So our estates and facilities team have heard about this and they're really interested in implementing. So we're thinking about whether we kind of roll this out to other groups rather than just nursing. And one thing we're really conscious of is keeping that uptake data really high in the live areas, so in our pilot areas. And one of the things that we're really keen to do is make sure that we continue to support our pilot areas as we kind of move on. And then I think ongoing monitoring to kind of make sure that as we roll this out, it's properly used is going to be really important as well. So and we can do that with the data from Allocate, which is really great. And the other thing that we are thinking about actually is in ESR now, you can record self-rostering as a type of flexible working. So that's something that we're also looking at to allow us to monitor this better. Thanks, Amy. I think that's it. Any questions?
Thank you, Inge. Thank you, Claire. Some really great examples there that I think whether or not you're working with teams that are rostered really applies. So just some of those practicalities around getting the representation from the different boards so that you've got the kind of leadership level buy-in and interest. And then those practical tips about, you know, whether it works best to go out to the staff group or use, you know, virtual comms, and the importance of leadership and engagement at the team level. So the difference you're highlighting kind of individual wards based on the sister in this case, for example. Thank you. There was a question on the chat about the amount of training and support that's been needed in order to implement this at the kind of team level. I don't know if either of you want to share some thoughts on that.
I think because we were rolling out the rostering system, that training was already much ongoing and in progress. With self-rostering, prior to self-rostering, staff had the ability to request 5 shifts on the system. So with self-rostering, it was simply a matter of removing that limitation and allowing them to request all 13 shifts. However, we still have staff who sometimes just wanted their managers to do their shifts for them. So we still had to offer some, not so much training, but sort of support to those who could use Employee Online. Employee Online is very easy to use, but I think one learning from it is that the rostering team did some drop-in sessions, and what we found actually that maybe into the future, what we do instead of them offering drop-in sessions for staff to come to them, it might be better for them to go to the ward in their environment.
Thanks, Inge. I think that was just another barrier, wasn't it, to kind of have to leave the ward and go. But yeah, I think, you know, for any of you that are already exploring use of employee online or rolling out a rostering system, the build that I've seen with your program at UCLH has been really valuable. It's like the next iteration of what you're doing. I think that's working really well. Great, thank you so much. Thank you to all our speakers for sharing your projects, your thoughts, your ideas.